during inspiration and expiration, our relative heart rate kind of changes. So when we inspire during inspiration, we see an increase in the sympathetic activity, and that causes an increase in heart rate, okay? And when we expire, we see a temporary decrease in our, or increase in parasympathetic activity, and that temporarily decreases our heart rate. So this is a natural phenomenon, right? When we inspire and expire, and this is kind of why we practice deep breathing as a part of meditation or something, or that type of therapy. And basically, this is manipulating the sympathetic and parasympathetic influence on our heart rate. And you also see this if you're a hunter, like hunters specifically use this to their advantage. So if you're aiming at a target, you typically aim while you are inspiring, and then you fire while you are expiring. And that's really important in keeping the body kind of stable or steady and preventing any disturbances that would otherwise prevent you from hitting your target. So shooters or archers typically use this to their advantage. And again, if we practice deep breathing, this is what we are manipulating. The chemoreceptor reflexes has to do with levels of carbon dioxide in the blood. And so this is a regulatory mechanism that affects our ventilation. So in instances of increased ventilation, or if we have excess carbon dioxide that we're holding on to, the response here is to decrease heart rate and to increase total peripheral resistance. Now, these are two contradictory responses if you really look into these two responses. If we decrease heart rate, what happens to mean arterial pressure? It decreases, right? We decrease stroke volume, we decrease mean arterial pressure. If we increase total peripheral resistance, what happens to mean arterial pressure? It increases, right? So both of these responses are contradicting each other, but they're basically helping to keep the blood volume or the blood volume or the perfusion stable. Okay, so we see an increase in total peripheral resistance and a decrease in heart rate, which is helping to combat that increase, that drop in mean arterial pressure. So the overall function that we see is increase in mean arterial pressure, even though we see a drop in heart rate. So again, the drop in heart rate is going to cause a drop in mean arterial pressure, but that rise in TPR is combating that drop in mean arterial pressure that we saw because of the drop in heart rate. Okay, so two effects that are kind of combating each other to keep that perfusion stable. The thermoregulatory responses, this is mediated through the hypothalamus. This is basically our hot and cold response. So this is the way the body changes its pattern of flow in the face of change in body temperature. So we have a core body temperature, and if we fluctuate from that temperature, let's say we have an increase in that body temperature, we see a decrease in sympathetic activity to the skin, not to the skin itself, but to the vessels that go to the skin, okay? Make sure you're making that distinction. And that causes vasodilation of those vessels to the skin. And that helps to stimulate heat loss as more blood flows to the superficial skin, okay? Alternatively, if we're really cold, if we have a drop in body temperature, we're going to see an increase in sympathetic activity. That's going to cause vasoconstriction of those arterioles to the skin, and that's going to shunt more blood away from your skin and towards your core to help preserve heat or prevent heat loss. Now, it's important to, again, point out that the baroreceptor reflex can be overridden here. So the thermoregulatory response takes precedence over the baroreceptor reflex. So let's say someone is dehydrated, they're overexerted, they have a drop in blood volume and a raise in body temperature. What kind of response would we see in terms of the baroreceptor reflex? Yeah, we're going to see a lot of different factors working to increase mean arterial pressure. But in that very same scenario, we're going to see that the skin is vasodilating, okay? So we know the other factors that we talked about to increase mean arterial pressure as a part of the baroreceptor reflex had to do with vasoconstriction of vessels, whereas the skin is creating vasodilation of the vessels. So again, we have two contradictory responses. So the thermoregulatory response usually trumps the baroreceptor reflex, okay? Meaning that blood will flow to our skin to help lose body heat, even in the face of the rest of our tissues trying to vasoconstrict. Okay, and this is another example of that baroreceptor reflex being overridden by the thermoregulatory response. So we see a possible consequence of decreasing TPR, which helps to decrease mean arterial pressure, and that is overridden in the case of the baroreceptor reflex. All right, this last slide here talks a little bit about exercise and the effect of exercise on cardiovascular function. And so what we see is that we have a few variables here, and then this is their percentage of change against the resting state. So we see a large increase in blood flow to our muscles. We see a large increase in cardiac output and a large increase in heart rate, okay? We see a very small increase in end diastolic volume. How can we explain that? How can we explain that small increase in that filling volume during exercise? Yep. Increased heart rate, exactly. So because we're filling and emptying the heart at a faster rate, remember we said that the heart needs time to fill, right? And it spends more time in diastole. So as we increase heart rate, we decrease filling time. So although we see a large increase in heart rate, we see a very small increase in end diastolic volume. So what is responsible for this increase in heart rate? If it's not the increase in filling volume, what's responsible? So what else can increase heart rate? So our sympathetic response, right? Our sympathetic nerves that are innervating the SA node and the AV node, they will increase the heart rate. And that's where we see this large increase in heart rate, although we don't see an increase in end diastolic volume. Okay. I also want to point out here that we don't see a very large change to total peripheral resistance. We see a decrease in total peripheral resistance because we have two very distinct changes to the vasculature happening. We have a majority of vasoconstriction, but we also see what vessels are vasodilating, what vessels are not increasing their resistance, given everything we've said so far. So if you're exercising, you're shunting blood to some specific organs, but you're also very hot. So your blood or your body temperature is rising. So what vessels would see vasodilation? Vessels to where? The skin, exactly. So vessels to the skin, vessels to the muscles, as we can see, and vessels to the heart, right? So we see quite a bit of vasoconstriction, but we also see a lot of vasodilation. And so we do see this drop in total peripheral resistance.